Welcome everyone. Tonight we're looking at one of the most densely packed home remedy demonstrations Barbara O'Neill has ever recorded. Onions, garlic, ginger, potato, cayenne, castor oil, charcoal, poultices and compresses for nearly every condition, from earaches to cellulitis to tetanus to strokes. Some of these ideas are harmless comfort measures, but others cross a line into replacing medical treatment for very serious conditions. My goal here isn't to mock anyone who uses home remedies. Warm compresses, teas, and soothing practices absolutely have a place. The real question is this: do these kitchen remedies do what Barbara claims, or do they risk delaying care when care truly matters? This video is commentary and education, not medical advice. Let's take a clear, evidence-based look at what she's teaching. Barbara demonstrates more than a dozen poultices. For onions, hot cooked onion on the ear for earaches, onion on boils, raw onion on the throat for strep throat, onion on the soles of the feet to stop coughing, onion plus honey syrup as a cough remedy. For garlic, crushed garlic wrapped on the soles of babies' feet as a natural antibiotic, and eating several raw cloves daily to replace antibiotic treatment. For ginger, ginger poultices to pull inflammation out of joints, reduce arthritis, improve mobility, and relieve chronic pain. For potato, potato poultices for cellulitis, inflamed wounds, conjunctivitis, welding eye injuries, and even preventing tetanus after stepping on a rusty nail. For cayenne pepper, taken internally to thin the blood instead of prescription anticoagulants after stroke or heart attack. Externally for neuropathy and cold feet. For castor oil packs to dissolve, bone spurs, fibroids, endometriosis, gallstones, kidney stones, cataracts, post-surgical scar tissue. Charcoal plus psyllium poultices for snake bites, spider bites, tick bites, and bee stings. Plus charcoal internally for poisoning. That's a huge list, and it mixes small truths with very big, risky leaps. So let's break this down carefully. Onions and garlic. What's comfort? What's risky? Let's start with the onion earache treatment. A warm compress, even an onion, can feel soothing on a painful ear. Warmth relaxes muscles, increases circulation, and distracts from pain. But here is the issue. Ear infections in children can sometimes become serious. If you put non-sterile onion juice into a child's ear and that child has a perforated eardrum, you can introduce bacteria directly into the middle ear. The idea that my child fell asleep and never had another earache is anecdotal. Many childhood earache solution own without any treatment at all. Next, onion on boils. The warmth and moisture may help soften the skin and bring a boil to a head. That part is plausible, but if a boil is large, spreading, or accompanied by fever, relying only on onion delays proper treatment for potentially serious skin infections, including MRSA, now the onion on the feet, to stop coughing. Barbara claims the soles of the feet have the biggest pores and absorb onion compounds that then stop coughing instantly. There's no evidence for that. The skin on the feet is among the thickest on the body. If a child stops coughing, that's likely due to natural symptom fluctuation or the bath before bed, not onion absorption. But here's something important. Onion and honey syrup can help coughs because of the honey. Honey does have evidence supporting nighttime cough reduction in kids over 1 year old. The onion is not harmful, but honey is doing the work. Now garlic. Garlic does have mild antimicrobial properties in lab settings. It may slightly reduce the frequency of colds when eaten regularly, but calling garlic a substitute for antibiotics, especially in infants or young children, is not supported by evidence. There's another risk. Topical garlic can burn the skin. Especially under a sock or bandage, garlic oil can cause blistering and chemical burns on children. Once again, comfort measures and real medicine are getting mixed into one pot, and that's where the danger lies. Now let's look at ginger poultices. Ginger on the skin creates heat and mild irritation. Heat can relax muscles and sometimes reduce pain perception. But in the lecture, Barbara describes dramatic recoveries. A finger frozen for 18 months suddenly bending overnight. Severe arthritis relieved instantly, swollen knees deflating within hours. While a ginger poultice may feel nice, these rapid changes likely reflect short-term increased blood flow and distraction, not reversal of arthritis or chronic inflammation. If a joint is red, swollen, hot, or unable to move, that may be infection, gout, or another serious condition. Only using ginger risks missing the real diagnosis. Next, potato poultices for cellulitis and rusty nail injuries. This is one of the most concerning parts of the lecture. Cellulitis is a bacterial infection of the skin. Untreated cellulitis can spread, cause sepsis, or lead to hospitalization. Potato poultices do not treat the bacteria causing cellulitis. In one story, she describes a 7-year-old with cellulitis whose antibiotics were stopped in favor of hot, cold water and potato poultices. The infection apparently disappeared overnight. The danger is obvious. Not all cases of cellulitis resolve quickly. Many worsen. Parents following this advice could easily land a child in the hospital. Now the tetanus claim. She states tetanus can only get in if the wound seals on the outside, and that hot-cold water and potato poultices are enough. That is false. Tetanus spores thrive in deep, oxygen-poor wounds. Even if the wound remains open, tetanus is still a risk. If someone steps on a rusty nail, you check. When was their last tetanus shot? Do they need a booster? Do they need proper wound cleaning? Are there signs of deep infection? This is not as long as it takes with potato. This is standard medical care to prevent a deadly disease. Again, comfort measures are fine, but delaying tetanus evaluation is not. Let's move to cayenne pepper. Cayenne does increase warmth and blood flow in the skin, but Barbara recommends replacing prescription blood thinners after stroke or heart attack with cayenne. This is extremely dangerous. Prescription anticoagulants prevent life-threatening clots. Cayenne does not prevent stroke recurrence or manage post-heart attack risk. Swapping them risks clotting, embolism, and death. Then she applies it to the feet to treat neuropathy from chemotherapy. Warmth can improve comfort, but it does not reverse nerve damage. Now castor oil packs. Castor oil makes skin warm and moisturized, but in this lecture it's promoted as a cure for bone spurs, fibroids, endometriosis, gallstones, kidney stones, cataracts, scar tissue from old injuries. There is no credible evidence that castor oil applied to the skin can dissolve bone, shrink fibroids, break up gallstones, or melt cataracts. These are serious medical conditions requiring real evaluation. Someone with abdominal pain from a gallstone attack who tries castor oil instead of seeking care could end up with pancreatitis, a life-threatening condition. Next, charcoal. Activated charcoal given for ingested poisoning is real. It's used in emergency departments for certain overdoses, within a specific time window with monitoring. But charcoal poultices on the skin do not neutralize venom from snake or spider bites once venom has entered the bloodstream. Applying charcoal instead of seeking emergency care for a venomous bite is extremely risky. Again, we see a pattern, a grain of truth blown into a universal treatment. By this point, you can see the pattern clearly. Harmless comfort measures become risky when they are promoted as cures. In this lecture, kitchen remedies are presented as replacements for antibiotics, tetanus shots, medical wound care, anticoagulants, evaluation of severe infections, treatment for eye injuries, emergency care after bites, management of gallstones, kidney stones, and fibroids. This isn't about rejecting a warm compress or a soothing tea. It's about recognizing when a condition is potentially dangerous. Here are true red flag symptoms that require evaluation, not poultices. High fever and chills, rapidly spreading redness or streaking, deep or dirty puncture wounds, rusty nail injuries, sudden vision changes or severe eye pain, weakness, slurred speech, chest pain, snake or spider bites, severe joint swelling or inability to move a joint. Poultices can support comfort, but they are not treatment for emergencies. Home remedies can absolutely play a role in comfort and recovery. Warm compresses, honey for cough, ginger tea, rest, hydration. These things matter, but when a remedy is promoted as a replacement for antibiotics, vaccination, stroke medication, or emergency care, the risk is no longer mild, it's potentially life-threatening. A simple rule of thumb: use home remedies for comfort. Use medical treatment for emergencies. If you found this breakdown helpful and want to continue this series of clear, evidence-based reviews of popular health claims, feel free to subscribe and check the playlist linked in the description. Thanks for watching.